I'm just starting the meeting now. So good afternoon all. Many thanks for joining us at this challenge event briefing for Inspired by Nature Health and Care Spaces. We're really excited to share this new challenge with you. My name's Kate Williams. I'm a programme manager at the SBRI Centre. And before we start off with the details of the challenge, I'm just going to run through the etiquette for the briefing event, and I will run through the agenda with you as well. So just please all note that this event is being recorded. After the session today, what we'll then do is upload the video up onto Simply Do so that everyone who wasn't able to make it today can access that information on the Simply Do portal. So in terms of the event etiquette, so as I've said, the event's being recorded, but for the participants, the cameras and the microphones are disabled. We'll be using the Q&A section for capturing your questions. The chat is turned off, so please just submit your questions via the Q&A function only. We'll be doing our best to capture all of those and bring those together throughout the event, and then we'll be going through the Q&A section once we've had the presentations from everybody attending today. So in terms of the agenda for today, I'll be doing a quick introduction and I'll just go through a little bit of information about the SBRI Centre of Excellence for you. We'll then be moving across to Steve Parks from Welsh Government Innovation, who'll provide some information on the innovation strategy and broader innovation activities across Wales. We'll then hear from Tom Doyle from Innovate UK, who will go through the wider context of SBRI, which is now known as Contracts for Innovation. We'll then move across to the key challenge holders, which are Rupert and Lewis, who will go through the broader challenge context with you. We'll briefly then go back to myself so I can just remind you of the funding amounts and the key dates. We'll then move across to Simply Do, where Josh will take you through the Simply Do portal, which we use for the application process. And then hopefully we'll have some time at the end to go through as many questions as possible. If we don't have time to get through them all, we will capture them and do our best to share the answers on Simply Do after the event today. So before we move into the main presenters for today, just wanted to provide you a little bit of information about the SBRI Centre of Excellence. We'll soon actually be changing our name to Contracts for Innovation Cymru, but at the moment you'll hopefully all know us still as the SBRI Centre of Excellence. So we work with the public sector organisations to identify what their unmet needs are and to work with them to bring those into challenges. We then put out to the market, like the one you're seeing today, to work with businesses, academia, third sector, to develop some solutions that hopefully address those unmet needs. So it's about creating that collaborative space so that the problem owners and the potential solution providers can work together to solve some key public sector problems. So, as I said, we work with the public sector to identify the challenges. We work them up into something then that is presentable to the market. We also do a lot of work in the background as well to work with funding providers to secure that funding for the challenges. And the thing to note that with Contracts for Innovation is that they're 100% funding for R&D. So hopefully that opens that funding opportunity up to a whole wide range of businesses, from small to large, and breaking down those barriers to participating in innovation development with the public sector. We also fully project manager the challenges from start to finish. So if you're successful in your applications for this challenge, you'll be working with the SBRI team throughout to deliver those projects. And we also support the challenge owners and the innovative suppliers to work together. And as a side to that, we also provide recognised training to support the capabilities of delivering innovation across the public sector as well. So that's probably enough from the centre, and just to kind of say, we, as a centre, we're funded by Welsh Government, but we're hosted by Betsy Cadwaladr, and we have an all Wales remit. So we work with the public sector across the whole of Wales to hopefully bring innovative solutions to the market. So I'm now going to hand over to Steve Parks, who's going to take you through the innovation strategy and broader activities within innovation. Thank you, Steve.
Thanks for that, Kate. If we can just skip along to the slide with my name on it. My name's Steve Parks, and I'm a collaboration specialist within the Welsh Government's innovation team. which is a job title I like 50% of and I don't like 50% of. I love collaboration. I love bringing people together to work on innovation projects. I'm not as keen on the word specialist because it just suggests that I'm very good at something and sets up some big expectations for me. If we can skip on, I don't think I'm not seeing the slides moving, so I'm assuming that they're okay in terms of what people are able to see at the moment.
For the moment, it's on the innovation strategy slide. Is that showing up for everybody else? I'll
No, the
click
first slide is still on there, Kate.
if I press the button again. Is that showing up for you now, Steve?
I'm still seeing the original first slide.
I think you might need to press start slideshow maybe, because I can see like the taskbar as well.
Give me 2 moments. I will reshare it again and then hopefully that will all work. But please do give me a shout if it's not working.
It might be you showing another window.
Is that showing up for you now?
That's brilliant.
Is that on the strategy slide?
That's it. Yeah. That's great. Thanks for that. Thanks for that, Kate. So the document you can see now on your screens is our innovation strategy, Wales Innovates. It was published a little while ago now, back in February of 2023, and we developed an accompanying delivery plan in the autumn of 23 that set out our ambition and how we were going to deliver the ambition for creating a stronger, fairer and greener Wales. Innovation is key to our success, but it's a word that appears everywhere and means different things to different people. So as Welsh Government, we've tried to keep things as simple as we possibly can. So for our perspective, innovation is about giving life to ideas to create new or improved products, processes and services. So to create something new or make something work better. And with the aim of those products, processes and services improving the lives of the people of Wales and the lives of those people who will live in Wales but are yet to be born yet. So there's a strong link to the well-being of future generations across our sort of portfolio and how we sort of support projects. We recognise we won't get there on our own. We believe that taking a collaborative approach will help us make the greatest impact possible. If we can skip on to the next slide, which is a nice visual of our mission. So innovation and therefore our strategy got a significant role to play in delivering our programme for government commitments. What we're looking to do is to give organisations the best environment possible for them to be innovative and to support them to grow and promote economic and societal benefit for Wales. We want to encourage effective collaboration across different organisations. We support SMEs, large businesses, the third sector, our universities and research organisations, local authorities, health boards, and I'm going to say and many more in case I get in trouble for missing anyone out. And we look to do that to try and create a genuine culture and community of innovation and innovators. And bringing us more to why we're kind of here today, we're also supporting the procurement of innovative solutions within the public sector and making use of that contracts for innovation mechanism to allow us to do that. If we can skip on to the next one. So Smart Flexible Innovation Support, or SFIS, as you may or may not have heard it referred to, is our sort of umbrella support for innovation in Wales. So we want to support innovative businesses and other organisations in Wales on their journey by helping them to plan and identify gaps and requirements. Co-investing is an important part of that support. We're looking to share the risk with organisations to stimulate innovation activity. So we see ourselves not just strictly as a funder of innovation projects, but a partner within those innovation projects. As I said, SFIS is the front door to our support. So we've got a team of innovation and collaboration specialists. You've got a diverse range of sort of experience and expertise taken from different industries and technology areas. So We don't know everything, but hopefully there's opportunity for us to bring those skills to bear in supporting and developing projects. We've got membership of a number of international networks at our fingertips as well that helps bring collaborative projects together. So we're part of the Vanguard Initiative and Enterprise Europe network, which gives us access to, I think at last count, it's 56 regions that we have partnerships with through our involvement in those bodies. Specifically, we're a delivery partner for the Enterprise Europe network, working closely with Innovate UK on that. The network helps to bring collaborators together by having, and this is a little bit of a scary thought, in each of the regions as part of the Enterprise Europe network, there's a version of me. So the idea is if somebody wants to collaborate with another region, we can link them with the person in that region who understands the ecosystem and who are the right people to speak to, and make that collaborative innovation on a global stage as easy as collaborative innovation on a local level. We provide funding to assist in organisations in developing and delivering their innovation plans, and we can provide access to specialist consultancy, including areas like digital and productivity and design. Quick plug from me as well on the international side. We will be running an online event next Tuesday on the 20th of May, which basically goes into detail on what the internationalisation offer from Welsh Government innovation perspective looks like. I'll share the link to register to that event if it's of interest to people. It's being fronted by a lovely man from Mid Wales with a receding hairline who you're listening to at the moment. So it could be an enjoyable hour and informative, hopefully. If we can skip on to the next slide. I won't spend a lot of time on this. We have got some priority areas and themes that we look at in terms of the projects we support, and you can see them up there. But we're very much conscious of the fact that innovation can happen anywhere. So although we've got some priorities, we've also got a very sort of broad outlook and ability to consider innovation wherever it lies. So we just skip on to the next one, which goes into the sort of procurement side. So what we're looking to do in terms of supporting innovation in procurement across the public sector is to create a more flexible and simpler system to better meet the country's needs while obviously remaining compliant, and open up those public procurement opportunities to new entrants such as small businesses and social enterprise, so they can compete for and win more public contracts. And we're looking to embed transparency throughout the life cycle so that the spending of taxpayers' money is properly scrutinised. So Contracts for Innovation, or SBRI as sometimes referred to in this arena, plays an important role in supporting that procurement of innovation by enabling the public sector to engage with the innovation community as we're doing today, and using challenges to take that right approach to problem solving. If we skip on to the next one, this is the one where I heap praise on people. The SBRI approach, Contracts for Innovation approach, has worked well for us. We've had successes with it, and we've shared what we do with different administrations internationally, which is always well received. So we claim to be, and I think we can justifiably claim to be, a bit of a world leader in this field. One of the reasons why we're able to do that is we've invested in establishing, as Kate said, the SBRI Centre of Excellence at the Betsy Cadwallader University Health Board, and I've got to be honest, we've been reaping the rewards of that ever since. So thank you to you guys for all that you do. It's something we often get an opportunity to sort of boast about in different arenas, and their expertise in driving these challenges forward is a key strength in our offer. A couple of examples and links you can have a look at previous projects that have won awards and recognition: the rapid sanitisation of ambulances, COVID challenge, and there's another one there on the childhood obesity and affordable nutritious food challenge that were both recognised for the good work that they did. if we can pop to the last slide, that's just me again, isn't it? So I'm always happy for people to reach out to me for questions on a sort of what can Welsh Government Innovation do for our organisation. So that's my email address there, and we've got probably one of the shorter group email addresses within the Welsh Government sort of portfolio. You can also fire off at collaboration@gov.wales, which is our team mailbox. So that's it from Welsh Government Innovation and how the sort of strategy links with what we're looking at today. So look forward to hearing the rest of the presentations and being on board with this challenge. Thank you.
Thanks, Steve.
Oh, you're on mute, Kate.
Sorry, if I can now move across to Tom Doyle from Innovate UK then, please.
Thanks. Both, yeah, for that introduction. It's good. Steve, you covered some of the points. I'm going to touch on lightly as well, so I'll try not to repeat things too much. So hi everyone, yeah, I'm Tom. I work at a very small team at Innovate UK, which focuses on using public sector procurement to enable the public sector to both support and benefit from innovation. My role specifically focuses on helping other external organisations use the Contracts for Innovation, or previously SBRI, funding mechanism, and the other part of my team sort of focuses on helping Innovate UK themselves use the mechanism and focus on our internal processes. Next slide, please. So, you know, for quite a long time now, and there's a lot of academic literature on this, if you go and have a look, there has been a focus on using public sector procurement as a way of improving public sector efficiency and effectiveness, hopefully both. It's particularly in line with the current government's mission-driven approach, but also, you know, in a reality of relatively tight budgets, it's a particularly important tool to help improve that situation in the future. Simply put, if you buy in more efficient, more effective solutions, you're improving efficiency and effectiveness. Of course, it's often not that easy. But the other reason that there's such a focus, on using procurement as a tool for innovation is because, depending on which figures you go from and which years you look at, the public sector spends between 300 and 400 billion pounds procuring goods and services every year. So just financially, it's a massive, lever that the government can pull to push things towards innovation. It's about a third of the overall public sector budget. Now, of that spend, obviously, there's many routine purchases where it's not appropriate to focus on innovation. There still remains a lot of need for frontline services, etc. But that potential there is huge, even if we think about a small percentage of that budget. Next slide, please. So that procurement of innovation is generally split into the public procurement of innovation, or PPI, and pre-commercial procurement, PCP. PPI is the public sector as an early adopter of technology or processes that exist. Maybe the public sector hasn't used them before, or they are really fresh to the market. So it's about using, cool, innovative stuff that's out there already and can be, is commercial products, essentially. Pre-commercial procurement, or previously SBRI, recently changed to Contracts for Innovation, is a way of funding the research and development of a solution when one doesn't exist. So it's a step before adoption and use. It's where it's used where there's not suitably efficient or effective solutions to adopt. It is currently referenced as sort of best practice in a number of strategic documents that are up there on that page, as well as Wales Innovate's strategy, as Steve's referred to. Next slide, please. So Innovate UK are the custodians of pre-commercial procurement on behalf of all UK public sector organisations. As a team, we have zero budget. I hate to use the word expert like Steve, but we are sort of a centre of expertise in the UK for public sector organisations can come to and say, how can we use this, as part of our procurement processes. It was originally designed by the European Commission in the early 2000s, back when we were all part of the EU, as a way of public sector funding R&D that more evenly balanced the risks and benefits between the funding organisation and those that are funded than maybe a grant-based approach. It's designed that no matter the size of award, it's not a subsidy, and that is something that's important to understand when you're in receipt of a Contracts for Innovation award. Therefore, they are less disruptive to the market than a subsidy-based or grant-based approach. It was implemented in the UK in 2008. Since then, I think we're up to a little bit more than is on this slide currently, actually about 1.8, 1.9 billion pounds spent through this mechanism, funding R&D, and obviously in isolation, that's a huge amount of money. But you know, if we are considering that there's 400 billion pounds spent procuring goods and services every year, and that's what we spent on this since 2008, it starts to look a little bit smaller. So you know, part of our role as a team is to help raise awareness of this within public sector organisations and help them use it. And there is an independent evaluation that was published a few years ago now on the UKRI website if you want to go and have a look at that. Next slide, please. So yeah, it's worth just being aware of that as a result of the Procurement Act 2023, which came into force in February this year, confusingly. There is now a mechanism within the public sector procurement regime which allows, you know, if they want to, public sector organisations to do contracts for innovation, pre-commercial procurement, develop a solution through a phased approach, and even eventually purchase that solution all within one procurement sort of process, only open once at the start. And that is quite a big change since the last Procurement Act, and something that we feel in time, hopefully government departments will make use of, and it should streamline the process of getting these solutions through to adoption. There's also an emphasis in there on pre-market engagement. So, you know, really trying to encourage the public sector to go and find out what's out there before just going out and using their, you know, standard frameworks, etc. And also a push of increased transparency, as I think Steve alluded to as well. So we're hoping that, you know, all these things together will, you know, generate a change towards slightly more innovation through procurement, through, you know, standard public procurement processes, and we're quietly positive on it at the moment. Next slide, please. So, you know, I think probably the easiest way to think of contract innovation is as an alternative to a grant-based approach. So we're not giving you know, a grant to do R&D, we're awarding a contract for R&D services. It's a pre-commercial procurement, so it wouldn't be used if there's a commercially available solution out there that met the user needs. So if there has been some pre-market engagement done and solutions already out there, then this is not a suitable mechanism, and we wouldn't use it in that circumstance. And we are always, you know, encouraging public sector organisations to make sure that that's the case. We don't want to spend public money on R&D when it's not needed. It is a very outcome-driven mechanism. You know, we're funding to solve a particular challenge, and it does require a particular challenge owner. Not to say that that owner is, you know, purchasing the decision at the end. Oh, sorry, back one slide just for a second. You know, but we want to ensure that there is an end user who would buy this and put it into action that helps a public sector, you know, policy or operational need, essentially. And as Steve said, you know, we need challenges to be relatively well defined, but, you know, to the extent that solutions can be developed to solve them, but not providing the solution as part of the challenge. Okay, I think I'll move on to the next slide then. So how does contracts for innovation differ to other funding mechanisms, in particular grant-based approaches that you might be more familiar with? Obviously, you'll find full details in the competition, but we'll just pick out a couple of things that differ for your awareness. So as you know, contracts for innovation, the new name for SBRI strongly suggests, it's a contract that's awarded, not a grant. That contract covers 100% of costs, with payments made on completion of milestones and in relation to the costs of delivering that specific milestone. Those costs quoted must reflect actual costs. They can't include profit. Contracts are always with a single organisation. That organisation may subcontract for specialist skills, but the lead organisation should carry out the majority of the work and remains accountable for the delivery of the milestones. That you know, was really put in there as a requirement by when this mechanism was developed to try and help streamline you know, these solutions getting through to commercialisation, particularly in sort of the big grant programs where there are lots of code leads. It can get tied up, you know, especially in the IP sort of area, and slow things down. Another difference is that the public sector funders retain some usage rights to those foreground IP. That's IP developed during this project. Essentially, that's there to ensure taxpayers aren't paying a premium at a later date if solutions are procured for the rights to use that IP as part of the solution, where the development of that IP has been paid for at 100% by the taxpayer. It's also in there to avoid subsidy control. So no matter the size of award, these awards are not subsidies. They will count as trading income to those in receipt of an award. And to avoid contravening international trade agreements, because these contracts are paid at 100% covering costs, whereas with a grant-based approach, you'd have to provide some match funding. Just to reassure applicants, though, they do retain 100% ownership of that IP. It's only a right to use it, which is in the contract, but do familiarise yourself with that. It doesn't restrict in any way the sale of future solutions to other organisations. And as I say, we've had a number of great success stories, and Steve picked out a couple of them, particularly, from the business growth and success side of things. And like other public sector procurements, this competition has to be open to all types and sizes of organisations. So unlike most of the things which Innovate supports, they're not only restricted to SMEs and so on. All organisations, though, must set out a route to commercialisation. Next slide, please. Yeah, it's just a textbook sort of map of how this mechanism would work. Generally, a larger number of suppliers getting smaller awards at earlier sort of feasibility studies, and then the sort of most promising solutions are down selected and funded at later stages through to hopefully the development of a solution. That sort of grey line there is what will in future hopefully change as part of the Procurement Act. So rather than there being a stop with the end of one process and the start of another procurement process, public organisations will have the option, if they want to just run one process that goes straight through. Next slide, please. I think that's it for me. As Steve said, do feel free to reach out if you want, although I would encourage you to look at the contact details for this specific challenge if it's in relation to that, and go there first. Thanks.
Excellent, thank you, Tom. We're now going to move over to Rupert and Lewis from Welsh Government, who are going to provide the border challenge context. Thank you both.
Thanks very much. Really excited to see this challenge come to life. So thank you to the Contracts for Innovation team, SBRI team, for bringing this along so well. My name is Rupert Chilvers. I'm Deputy Director for Life Sciences and Innovation in Welsh Government with Health and Social Care and Early Years team. I'm here with Lewis, who will introduce himself when he gives his part of it. But I'm just going to kickstart you on what the challenge brief is about and what we're thinking about when this came out, really. So in terms of the brief itself and the way that you see it written, I've just taken a few areas out and just wanted to familiarise you to it. This is a phase 1 prototyping effort. There is this idea around a demonstrator, which is called phase 2 here, and it's important to understand what we're trying to achieve with the demonstrator while you're thinking about the prototype development. In the prototype development itself, the general gist here is to co-create a pod-like, unit-like system, space, whatever it is, that is user-friendly, safe, secure, affordable and accessible for all. We'll go into what we mean by those terms, but essentially that's what we're trying to achieve here. This is very much about population health, as well as all the types of services that we do, and how do we bring that to locations nearer the home and in the community is very much of interest to us. But when we do bring that to these locations, how do we make it entirely accessible? Not to repeat mistakes of the past, and really think about all the important learnings we've had about how to look after people and how to help people look after themselves. So that's what this is really focusing in on. We do have an ask that those of you who do participate and are successful will come to Eisteddfod in Wrexham on the 2nd to the 9th of August. and share the design and a scale model prototype of your work. So it is quite an ask, but an exciting one, we think. In phase 2, we are looking at how this becomes a thing. And when it becomes a thing, it needs to build in technology. And when it builds in technology, you have to think about certain things, and you have to think about how it's made, how it incorporates these technologies. And that's why we've described phase 2 to you, so that you're mindful of that when you're developing phase 1. So some of the accessibility conversations we might be having with you, such as noise prevention and all of that, may not come to fruition until you get to phase 2, but you need to think about that when you design now. So if you go to the next slide, we've just got a few slides for you to help explain what we're thinking about, so that as you're thinking this through, things become a little bit clearer, but please do ask questions as well. So what we find is that we don't have enough spaces and pod-like spaces that really meet the needs for the people who need and want it, and for the service providers who need to use it. So here is just some reasons that we've put here in terms of why people might want to access such a space. And that's because it sits in the community, it's accessible to them and meets their need. And it's because there's a privacy element in the way it sits in the community. And we know there are lots of solutions out there. We know you can have a room and kit it out, but this is about something that sits somewhere convenient and gives someone somewhere outside of their home to access services. And as I described in phase 2, digitally enabled services. And it's somewhere different to be for them because of whatever circumstance they're in outside of their home. So we know you can meet some of these areas within the home, but not everyone can and wants to do that. In terms of service providers, we know that online consultations are growing. The need to support people remotely and for self-help purposes is growing. So this is trying to address that need. The ability to be present in a virtual sense and be available to people in a virtual sense is important. So this isn't about someone sitting with someone in a space. It is about interactions of whatever nature that's synced in time with someone who's happy to help them, or not synced in time with that. So this is about reaching people who might not otherwise use services, and where staff need support to work flexibly, being able to still use technologies to do their work. Next slide, please. So, I wouldn't do my job if I didn't use AI to give you a visual, but basically this is AI visuals when you put these type of concepts in. But essentially, I'm about to go into the inspiration part of this, but inspired by nature is so important to us in this challenge. It's very much about our health and well-being. Being supported by nature. We know the science behind that, so why don't we use that in our design? And that's what's really important for us to capture here. And in the way that I'm showing you on the screen, it is about biomimicry, which I'll say a little bit about, but what is it in the way that nature tells us we want to engage, we feel relaxed when we engaged, the materials that you use, the shape, the feel, the smell, the light, what is it that's coming out of nature that we want to bring into such spaces? This is the right type of competition to put that thinking into, and just go mad with the thinking around what is the art of the possible here. And that's what we want you to do in this competition. It is an exciting opportunity, so please do take it to the edges of what we have in our creativity to bring to this challenge. Next slide, please. So why and why now? It's groundbreaking designs are hard to find. I have over many years come across many pods, many interactions in the community, many ways in which people want to tell us that they have given solutions into this space. They're not entirely suitable for what we are talking about. they're not entirely suitable for all the audiences we want to reach in health and social care. And we do want to work in the community effectively, and now is the time to plan for that future. So that is why it's happening, and why it's happening now. We have really made an effort here to pull out 3 important priorities in Welsh Government and for Wales. Supporting people in the community and safely accessing the technologies that we know will support their care is super important to us. So that is coming to you in this challenge to help us find these solutions. Making these spaces accessible is not negotiable criteria. It is utterly important that we don't design people out of these spaces. So that is what we're also bringing into this challenge. And then using the design and development principles that we know comes from nature, we know comes from the environment, and sustainability is not negotiable either. So that's what we're also bringing as a challenge to you, because you will have brilliant solutions for us, and this is the time to do that. Next slide, please. So I'll cover a little bit about sustainable growth, and then I'll hand over to Lewis for the accessibility. So I don't think I need to say much, because we have had decades of being told what we need to be doing for the globe to survive, basically, and we're bringing that to you in this challenge. There are legislative drivers here that you will be mindful of: a net zero by 2050 and a ministerial ambition for the public sector to be net zero by 2030. So there is nothing we want designed here that is going to go against these targets. We understand that will create some areas of compromise and cost, but out there, they're probably partnerships you can form to bring that into your competition bid. But please do look to biomimicry and what we know we can learn from living organisms about how we create spaces that work for everyone and work for sustainability as well. So I will hand over to Lewis at this stage. He'll go into the accessibility, if I've got my slides right. So next slide, go ahead.
Diolch, Rupert. I'm Lewis. I'm the Senior Equality, Diversity and Inclusion Officer in the Health, Social Care and Early Years Group in the Welsh Government. I'm not going to repeat what Rupert said, but this is a really good opportunity for us to be able to take services to those parts of the population that maybe aren't accessing health services as much at the moment due to those barriers that are in society at the moment. So it's really, from my side of things, it's really about reducing those health inequities and trying to make sure that people can access those services. So, this is a really good opportunity to think about the accessibility element right at the beginning. So then when it comes to designing anything, that's kind of built in, so it's not at the end. So I'll go through some of the things to be considered as part of the kind of accessibility side. So first off, Welsh language. So we've got a plan in health, it called Mwy na geiriau, or more than just words. And this sets out something called the active offer. So the active offer is making sure that when someone in Wales accesses health service, they shouldn't have to keep asking for services to be provided in Welsh. So if they give service provider their language preference being Welsh, then everything will be conducted in Welsh throughout their journey in that health journey, whatever that may be. So any products designed need to take that into account. This falls under the Welsh language measure, and the health boards as well in Wales have the Welsh language standards imposed on them. So there's a statutory duty on health boards in Wales to provide Welsh language services to those that want them, and like I said, in a proactive way. And then if we look at being accessible for LGBTQ plus individuals, it's just simply making sure that any interface is used in gender neutral language, and try not to use anything too gendered, because you might not, especially at the beginning of any process, any service isn't going to know an individual's pronouns or gender or anything like that. So just keeping it gender neutral to avoid any issues there. There's a set of standards in health called the All Wales Standards for Accessible Communication and Information for People with Sensory Loss, which is a very long title. This is basically a set of standards that tell the health boards what services they need to provide to patients with sensory loss. This has actually been updated, so we're hoping that the updated standards will be published by the summer, and these standards have been broadened. So they include anyone with any additional communication needs. So that could be people with sensory loss, that could be someone with dementia, neurodivergent individuals, and people whose preferred language isn't English or Welsh. So that could be, those seeking sanctuary. And these standards basically as a directive to health boards on making sure that people with additional communication needs can access health services just as well as those who don't have those additional needs. So I'll go into some of them now as we go on to the next slide, I think. There we are, brilliant. So like I said, one of the things under the standards now would be community languages. So those with languages that aren't English or Welsh. Obviously, some parts of Wales have different community languages, so it'd be making sure that we take into account kind of regional variances across the country. So, for example, where I am now in Cardiff, there's going to be there is a great diversity of community languages, especially depending on where you are in the city. So, making sure that interfaces are available in those languages that people are going to be accessing, to make sure that anything people are using is going to be understood. Anything to do with receiving health services, we need to make sure from a patient safety perspective that people know what information is being given to them and they can understand what they're being told by healthcare providers. Neurodivergent people as well are obviously a consideration in this, and this comes under the renewed accessible communication standards. So, and that just takes into account things like recognizing environmental factors for effective communication. So, certain color contrast when it comes to anything written on a screen. Alternative formats for that might be useful, because the standard black and white can be have sensory issues attached to them, as well as any background noise, making sure that any physical environments aren't too overwhelming or too overstimulating, to try and minimize a person's anxiety. This also ties in as well with anyone with dementia. Any kind of really overstimulating environments could be possibly too much for those with dementia. Then when we look at carers as well, and this comes into when we look at any people with accessibility equipment, that's for those who are disabled, we need to make sure the consultation spaces are large enough, because some of those attending may have carers with them or a companion due to a multitude of reasons. So like I said, for example, anyone with maybe mental health conditions or dementia will have a carer with them. So any space needs to accommodate that. And also some people as well with certain conditions may be claustrophobic. So, we want to make sure the spaces aren't too restricted in that sense. And like I said, for those with disabilities, not just wheelchairs, but other equipment as well that people may need to, because of the disability, just to make sure that spatial awareness is taken into account, not just inside the structure, but getting in and out of the structure in a way that that's easy and maintains a person's dignity as well. And then sensory impairments, this could be visual or hearing as well. So making sure that anything visual takes into account anyone who's blind or partially sighted, just so that people can confidently navigate their surroundings. So making sure that entering the structure and being inside it, there's nothing going to be on the floor that's going to maybe be an invisible tripping hazard for anyone with who are partially sighted. And messages displayed on screens as well have maybe the capability for an audio announcement for information, so that person has that option of listening as opposed to reading. And then those for those with audio issues as well, making sure that there's things like hearing loop induction system or similar technologies for anyone with any hearing aids. And just as with community languages, you know, BSL is a community language as well. So we need to make sure that anyone who uses BSL, is a BSL signer, can use that or have that used with them via a system, so a video relay service or a video service. So just as you'd have a community language maybe spoken, you could have a video with BSL as an option as well. And then finally, there are some people who have lower literacy, and as such, information should be provided in plain, clear and concise language. I mean, that should be the case anyway, especially with health information, to make it as simple and as accessible as possible. But especially for those with low literacy, you know, information should be available in accessible format. So for example, again, an audio file or verbal correspondence can be easier for those with lower literacy, as opposed to a bulk of quite wordy text. I can't remember what's on the next slide. Have I finished? Or was there... Yeah, there we are.
We have finished. Thank you. So thanks very much for listening to this part. If you have any questions, please let us know. But it's an exciting opportunity. We think we can create some amazing designs and prototypes. So please do work with partners and across interdisciplinary and multidisciplinary perspectives to bring this together. Thank you so much.
Brilliant. Thank you to Rupert and Lewis. There's been some really fantastic context and really helps to bring the challenge to life. So thank you very much. So just to kind of reiterate in terms of the funding amounts, as Rupert referred to at the start of the presentation, the intention is that this is a two-phased challenge. At the moment, we're looking at phase one, looking at feasibility projects in terms of the design of that space. So currently the funding available is available to support up to 5 projects. And each of those projects can bid up to £50,000, including VAT. So only those who participate in a phase one delivery will be eligible to apply for phase two. However, we're yet to confirm that the funding is available for phase two. So any phase two funding will be subject to availability, but also dependent upon the outcomes of the phase one feasibility, because we're really looking forward to seeing what exciting ideas and designs come through in this early phase. And just to remind you of the key dates. So currently, the closing date for this challenge is 6th of June. That closing date will be at 12 p.m. on that day. So please do not leave it to the last minute to submit your applications. If you do have any IT issues and things like that with the portal after this time, unfortunately, we won't be able to help you with that. So it is a hard deadline of 12 p.m. on the 6th of June. But please do note that these dates could be subject to change, particularly if we need to look at the numbers that are applying at that time. Following the closing date, there'll be a period of assessment. And what we're hoping to achieve is that projects will commence at the end of June. As we've already mentioned, we are looking for the project deliverers to present their ideas, their concepts, hopefully new models and things like that during the Eisteddfod at the early part of August, and the potential completion of the overall projects and the deadline for the phase one report is towards the end of August 2025. As I said, though, these dates may be subject to change at a later date. So please do keep an eye out on the Simply Do portal for any changes, and obviously across the social media as well. But these are the current dates. So please be working towards a closing date of the 6th of June as an application deadline. So I'm now going to stop sharing my screen and move across to Josh from Simply Do, who will go through the Simply Do platform and the process for application and where you can find all the information that you need for this challenge. Thanks very much, Josh.
Super. Thank you, Kate. And again, thank you, Rupert and Lewis, for the information you provided. I think it really helps set the context as to how important this challenge really is. And it's such a great opportunity. So I'm just going to spend the next 2 to 3 minutes walking you through the step-by-step process of how you complete your application using the Simply Do platform. So hopefully you would have all received a link and have access to the platform before, but if not, we will pop one into the chat for you so that you can access Simply Do. When you do have access to that link, you'll arrive at the page that hopefully I'm now sharing on my screen. This is the challenge page for the Inspired by Nature, Health and Care Spaces Challenge. A lot of the information that you've received today in form of presentation can be found inside of this challenge page itself. So inside of the brief, the scope of the particular project, the individual challenge themes, so within the prototype development. I'm not going to walk through all of this. A lot of this information has already been talked through today. But should you need it, it will always live inside the Simply Do platform on the challenge page. So information around the funding, etc. Right at the bottom then here, where we currently have the briefing event link, that's where the slides and presentation from this particular meeting will be placed so that you can access this information after this event. So that will be found inside of here, as well as you can see the key dates that Kate has just walked through. At the bottom of the page then, there's lots of various links, English and Welsh documentation, which you might want to have a scan over prior to beginning your application, so FAQs, example contracts, etc. When you're ready, all that you need to do is click Create Your Idea, and at that point you'll be taken to register for an account or log into an account for Simply Do. Once you have done that, you will arrive at the application form. So as you can see, there are various sections within the application form which will need to be completed. All that you need to do is work your way through the application form from top to bottom, completing the application form. As you work your way through this application form, the platform will save for you as you're working on the application, so you won't need to save it. You can go away, close your browser down and come back at any point in time, and the platform will have saved your progress for you. If you're working collaboratively with individuals in your organization or indeed in a different organization, you can invite that individual as a collaborator to begin working on this application with you. So select add a collaborator and then pop their email address into here. You can then both be working on this application form together prior to the deadline. Finally, once you have completed the application form, all that is left to do is come up to the top of the screen, which is currently grayed out because I haven't completed the form, and click Submit. That's all that you need to do to complete the application process for this SBRI challenge. Complete the whole form, submit once you've completed, and you should be good to go. Make sure that you submit, as Kate has already mentioned, prior to the deadline. If the deadline passes and you haven't submitted, this submit button will not be available for you and you won't be able to submit an application for this challenge. Finally then, before I kind of hand back over to Kate, if you have any technical issues when you're operating or using the Simply Do platform and you need to reach out to us from a technical standpoint, come down to the bottom right hand corner of the screen here and open up a conversation with myself or another member of the Simply Do team, and we'll be happy to jump on hand to support you. Best of luck with all of your applications, and I'll pass back over to Kate.
Thank you very much, Josh, and many thanks to all the presenters that we've had here today. I'm really grateful for your support, and as I said, some valuable context shared about the challenge that I'm hoping will be useful to everybody here today. So I'm looking at the Q&A section, and we haven't got any questions as yet, but I will give it a minute or two just in case anybody does have any questions to submit. I've also put in our email address, which you can contact us via directly if you do have any follow-up questions. As Josh said, if it's kind of technical stuff about the Simply Do platform, please contact them via that portal. But as I said, if there's any other questions about the challenge and any queries that you have, please just drop us an email and we'd be happy to get in touch with you. One other thing to add as well, whilst I'm waiting for some questions to come through. As Tom said earlier, it's a UK-wide contract that we use for all our projects. So I would encourage you, it is included in the additional information at the bottom of the Simply Do page. I would encourage every applicant to make themselves familiar with that contract before they apply, because if you are successful, that is what you'll be signing as a project deliverer. So please could Stephen put the link in the chat for next week's Tuesday event. Fab. Steve, if you're able to do that, that would be great if you're able to pop that in directly. So I believe that's to the European event that you're holding on Tuesday. If you are able to pop that link in, that would be great. Thanks very much, Steve.
Yeah, I'll get that sorted now. Thanks very much.
Lovely. As I said, I'll just give it a minute or so more, just to allow some more time for some questions to come through. Although, as I said, you know, Rupert and Lewis did a fantastic job of running through the challenge context. So hopefully that has made things a lot clearer for everybody and has been a really useful opportunity. I will give it a minute or so more. Is there anything else any of the other presenters wanted to add before I bring this to a close? But as I said, I will leave a little bit of time for further questions. We all good? As I said, a copy of this event will be uploaded to the Simply Do platform, hopefully later today, or if not, Monday at the latest. Okay, we do have one question coming through. Do you know how the milestones for R&D programs will be determined for procurement opportunities? Hopefully I've got the context of that right. Won't be determined. You might need to send that to me in an email afterwards, if that's okay, just so I can get the kind of the context of that question. So in terms of the milestones for the actual project deliverables, what we will expect is a part of the application process that you make clear, you know, what the deliverables are, and we'll have kind of clear payment milestones within that application, which will be agreed as part of the contract, that, you know, once you've completed those particular deliverables, we'll be reviewing progress and then approving payment. It is quite a short duration of the project, so I'm not expecting a huge number of milestones within that. But as Tom noted earlier, payments are on deliverables. So, you know, we won't be expecting requests for advance payment ahead of the project delivery. It will be based on what you've delivered as part of that project. So hopefully that meets the question that you were asked, but if not, as I said, drop us an email via the SBRI email and hopefully we can go back into that in a bit more detail for you. And fab, Tina said, okay, so that's great. Hopefully I have covered that. Okay. I'm not seeing any further questions. As I said, feel free to get in contact with us via the email address after today's event if you do come up with some questions that you're not ready to share at this point, and we'd be happy to help you. A little bit of a reminder as well, you know, it's been reiterated a couple of times, but please be mindful of the 12 p.m. deadline. If you go past that, unfortunately, we won't be able to help you. So please don't leave it to the very last minute just in case of technical issues. If we're not having any further questions, then I'm happy to bring this event to a close. Many thanks to everybody who's joined us today. And as I said, huge thanks to the presenters and for the information that they've shared today. Best of luck to everybody. This really is a creative and exciting challenge, something quite different from what we've delivered before. And we're incredibly excited about it. And I hope that you are as well. And we look forward to seeing your applications coming in over the next few weeks. And best of luck to you all. Thanks again for attending. Bye.